Thanks to everyone for tuning into this morning's Wisconsin Health News virtual newsmaker event with Exact Sciences CEO Kevin Conroy. Thank you, Kevin, so much for sharing some of your valuable time with us today. Before we get started, I want to make sure we thank Badger Bay Management for hosting today's event in partnership with Wisconsin Health News. And thanks so much to our generous sponsors of the Wisconsin Health News Newsmaker Series for making today's event possible. A huge thank you to Anthem Blue Cross and Blue Shield of Wisconsin, Deloitte, Froedtert and the Medical College of Wisconsin, Husch Blackwell, Mayo Clinic Health System, Briesen Roper, and the Wisconsin Hospital Association. For those of you who are just hearing about Wisconsin Health News, we are an online, nonpartisan, independent news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, you can sign up for a free trial to the newsletter at wisconsinhealthnews.com, or you can also sign up through the event evaluation form, which we'll email out after today's event. And an extra thanks today to Briesen Roper, who is today's featured sponsor. Briesen Roper is a new event sponsor this year, and we are just so thankful for their willingness to stick with us as we have shifted to this virtual format. Their support has been integral in helping ensure that these important discussions continue. Briesen's health law section dates back to the 1950s, but the section has evolved to today providing a contemporary platform for legal services to the healthcare and life sciences industries, from mergers and acquisitions and affiliations to compliance, from healthcare systems to long-term care to biotech companies, from data privacy to fraud and abuse. Today and tomorrow, Briesen is committed to providing sophisticated legal services to the healthcare industry throughout Wisconsin. More information about their team and capabilities can be found at VonBriesenHealth.com. So thanks again to Briesen and all our sponsors for your great support. And thanks again to Kevin for being here today. Kevin Conroy is the chairman, president, and CEO of Exact Sciences. Over the past decade, he's transformed Exact Sciences from a small biotechnology firm into a growing cancers diagnostics company. The company is best known for its colon cancer screening test, Cologuard, which in 2014 became the first medical device to receive FDA approval and national Medicare coverage simultaneously. In the past year, it's added to its oncology testing capabilities with the acquisition of several new companies, including the $2.8 billion takeover of Genomic Health, whose Oncotype DX provides gene expression tests for breast, prostate, and colon cancers. Meanwhile, it's continued a research and development partnership with Mayo Clinic that has expanded into up to 15 different cancers. This spring, Exact Sciences launched a new product, a COVID-19 test. It delivered its first test on March 30th, and since then has tested 500,000 people in all 50 states while building up its capacity to 50,000 tests a week. So I'm looking forward to talking with Kevin about this transition to COVID-19 testing, where that goes from here, and how the pandemic will impact the future of cancer screenings, tests, and care. Finally, thanks to everyone who submitted questions with today's registration. We unfortunately won't have time to get through them all, but I did pick a handful that I think best represent the sentiment of the questions that were asked, and we'll ask those at the end of today's webinar. So Kevin, I was hoping that you could start by sharing a little bit about how Exact Sciences got into COVID-19 testing. It's my understanding that it in part involves a March Sunday afternoon conversation with Promega CEO Bill Linton, and also initially a desire to test your own employees. So could you just share briefly with us a little bit how you got into this?
Tim, first of all, thanks for having me on your show. It's great to be here and talking to healthcare leaders, or hopefully healthcare leaders are participating across the state. The COVID testing opportunity really came about as in early March, we were very concerned about making sure that our own employees were tested. And then I had a conversation with Secretary Andrea Palm about whether we could help the state bring up testing capacity. And it was difficult for the state to do that because of a limited physical capacity to bring up significant amounts of COVID testing. So we offered to explore the possibility of bringing it up ourselves. I talked to Bill Linton, who was very supportive and helpful. Promega is an incredible company and helped us bring up the test. Epic jumped in and helped. CUNA Mutual provided people to help us, and Anthem also did. So it really was a group of people who said, what can we do to help the state? And it is one of the most incredible things that I have seen happen in my 11 years at Exact Sciences. I'll read a quote. So one of our engineers who is responsible for bringing up new tests sent me an email, and this is somebody that I've worked with for 15 years altogether. And he said, have I ever taken a clinical test from 0 to tens of thousands in 3 weeks? No. Have I ever done so under quarantine with all key stakeholders remote? No. How do I know we can be successful? I know we will be successful because we have a deep and broad team with years of experience working together, doing what everyone thought was impossible. So he wrote that note at the very end of March. And by within a few weeks, we had significant capacity to help the state. And I'm glad to say now there are about 80 labs throughout the state that are doing COVID testing, with 20 more coming online. So it has been a really broad effort, and Governor Evers and Secretary Palm really helped make all of this possible. And so you really have to give credit to the public health officials and leadership in the state.
Thank you for sharing. I mean, it is a really great Wisconsin story. Can you share with us exactly Exact Sciences' role in this process? What role do you play in this partnership? And who are conducting these tests that you guys are involved in? Is it the health systems, the community testing sites, both? Tell us some more of the details.
Here's what Exact Sciences is really good at. We're really good at taking a patient sample and analyzing the DNA or RNA in that sample to give a really sophisticated result. In this case, you're testing to see if the viral RNA, all a virus is a strand of RNA or DNA covered by a protein or proteins. And so what our test does is looks to see if a very specific sequence of letters, basically molecules, exists in that sample. And so what we do is take a sample, we run it through what's called a molecular test, which is a really sophisticated, complicated process that generates a test result. So we take in the little vials of saline preservative that comes from testing a patient, and we process that all the way to a result and report the result back out. We don't collect the sample. The state has been doing that, and health systems have been doing that. What we do is generate the result and report it back. And we had the physical capacity at Exact Sciences to bring up the test, and also importantly, the robotic instrumentation and the team. So we have 300 of our people today working right now on COVID testing, and altogether about 1,000 people touch this test in one way or another.
And where are these tests being conducted? Is it at all the different health, is it at many of the health systems? Is it at these community test sites? Where are these Exact Sciences tests right now being conducted?
Yeah, the site where you actually get a nasal swab sends that tube, that little saline tube, back to our site at 650 Forward Drive in Madison, or Badger Road in Madison. So we're running tests in 2 of our different labs here in Madison. So all of those samples come here, we test them and report the results.
And I understand you are up to 50,000, the capacity to do 50,000 tests a week now. Is that the limit? Are you going to go further? What's kind of the forecast for what you guys see doing going forward?
Yes, we're continually expanding our capacity, both our people, the facilities, the instruments, and we're in this for the long haul to help the people of our state. And also, we've tested people from all 50 states in the country.
Yeah, sorry, go ahead.
Yeah, and so that we have facilities in the Bay Area in California, and in Phoenix, Arizona, and in Salt Lake City. And we are supporting testing across the country through partners that also need capacity. So the state of Wisconsin is not our only customer. We also wanted to help all of the communities that we do business in.
And how is that spread out? Of that 50,000, what percentage is in Wisconsin versus the other 49 states that you guys are working in?
The majority is in Wisconsin, but a sizable amount is servicing people around the country.
And is this, I mean, you guys, before this, had your Cologuard screening test, you're bringing other screening tests on board. Is this COVID-19 test a long-term thing? Is this something you guys plan to stay in for the long term?
I like to say we want to be out of COVID-19 testing as soon as humanly possible, because that will be the day that we can, our entire country and our state and our communities can go back to normal life. And it is probably not a long-term thing. We just wanted to do our part to help bring up capacity, and that's what we're incredibly proud of. I mean, being able to do we have tested over 500,000 people, and in the state there have been about 1 million tests run to date. So we're right around about half of the capacity of the entire state.
Do you have a number? You're at 50,000. Do you have a number that you think you can get to beyond that?
We haven't talked about what that number is. We kind of like to underpromise and overdeliver. Suffice it to say, the spirit of the team will rise to the occasion and continue to increase the capacity.
So last week, Advocate Aurora Health announced that due to a shortage of a certain reactive agent, it was suspending testing before certain procedures and closing most of its community testing sites. Are you starting to have any similar supply issues yet with your process?
We haven't. We are not as dependent on any particular supplier because of the way that we developed this test ourselves. Mm-hmm. So we have our supply chain is more robust than a health system lab, and we have worked with Aurora closely. They've been an amazing partner in helping the state out, and so hopefully we'll be able to continue to do that and be there for them as they have been there for the broad community here in the state of Wisconsin. So
it's starting to get better as tests start to tests, in part because tests have decreased over the past week. But there has been struggles with some of the larger national labs in terms of the time that these tests are turned around. Sometimes it can be even over a week. And that is in part due to these supply issues. With less of a supply issue, are you not maybe experiencing that? Or what is your status right now with your turnaround times? And do you expect to see maybe any strain on that if supplies do become strained going forward?
Yeah, the vast majority of our tests are turned around within 48 hours. We prioritize testing of people who are waiting for a medical procedure or surgery, and over 99% of all tests have been done within 72 hours. So our team has worked around the clock and weekends to make this happen. I can't even tell you how proud I am of the team at Exact Sciences who are working multiple shifts to get this done. And we're going to keep doing it. And it is, we feel that it is making a difference. I'll give you one example. Mm-hmm. Here at Exact Sciences, we're testing our team members who are coming into work. And we're testing them on a regular basis, every couple of weeks. And we have performed 15,000 tests. And we've only had, and this is around the globe because we have people all over the world, we've only had 80 positive results. And we don't have any examples where we know that a person has transmitted it from one employee to another. And what that tells you is if you have regular testing and you quickly get somebody who is positive back home safe, seeing a doctor, you can really limit the spread of this. And part of the reason we're limiting the spread is people are wearing masks at work, and we have instituted really early on physical distancing. So this is a model for, we think, the whole state. If we want to turn our economy back on, there are some really basic things that we can do to make that happen.
So this fall, it's likely that flu cases with similar symptoms will start to tick back up, placing more strain on testing. Colleges and schools in some districts are getting ready to open this fall. And like you said, testing does play such a pivotal role in this road back to some sense of normalcy. Did you think, as someone who's so intricately involved in the state's testing process, does the state have the capacity will the state have the capacity this fall, do you think, to adequately use testing in the way that you are saying to play the vital role that it can?
Yeah, I believe so. I think that, again, there are 80 labs testing today. It is not just Exact Sciences. And 20 more are coming online. And I suspect most labs will also bring on a flu test, so that if somebody is symptomatic, we test those people for both coronavirus and flu. And so that you can very quickly give a result to somebody and let them know whether they have COVID or the normal seasonal flu. And that's important. So we will invent yet another test here over the next couple of months and seek FDA clearance on that test so that we can support the state and our communities around the country.
So maybe talk about that a little bit more. What is this other test you're working on?
Well, that test is a flu A or flu B
okay.
test. Yeah.
Okay.
So that if you come in with symptoms, you don't know what you have, you want to get a test that will tell you whether it's COVID or flu A or flu B or neither. And let's all pray for a very low flu season this year. I think with all of the lack of travel between other countries and our country right now might mean that the flu season is somewhat diminished. And with, again, these safety steps that people are taking to make sure that you aren't transmitting viruses, it's really important.
So shifting gears a little bit, cancer screenings as well as cancer diagnosis rates are down. They're definitely down this year compared to last as a result of delayed care due to the COVID-19 pandemic. What long-term impact do you think that this could have on the overall health system? And what factors do you think need to be considered in terms of patient care if there's another surge this fall and maybe there is a consideration of stopping procedures or halting some procedures going forward?
Well, there's a group of modelers who just took the number of people who didn't get colon cancer screening, cervical and breast cancer screening, which there were millions of people in a 3-month period of time who didn't get their normal screening. And they project that will lead to an additional 10,000 deaths from colon and breast cancer. It's imperative that we get people back in to get a screening colonoscopy or a Cologuard test or a screening mammography. We can't stop doing that. Cancer doesn't wait for COVID. And so if you have stage 1 cancer, colon cancer, 9 out of 10 people survive. Stage 4 colon cancer, 1 out of 10 people survive. If you wait to get screened and the cancer progresses from stage 1 to stage 4 while you're waiting, it changes the outcome of your life without question. So we need to get back to actively screening, again, through screening colonoscopy or through Cologuard. One of the great things about Cologuard is that you can do it in the privacy of your own home. So we have seen the Cologuard volumes be at least at the level they were at before the pandemic. Despite
that's where you're at now, did that continue or did you see a drop?
That's what we said on our earnings call from a couple of weeks ago. I can't provide more clarity. Suffice it to say that there's about a 30%, 20 to 30% drop off in Wisconsin in the number of interactions with healthcare, even when you add in the telemedicine visits. So we need to get people back in to get mammography. We need to get people to get back in for their colorectal cancer screening, whatever form that is.
Mm-hmm. You actually mentioned on that earnings call a couple weeks ago that due to maybe an increase in patients willing to get certain types of care at home, that you could see this could lead to an increase in those who seek Cologuard as a way to get their screenings. Could you talk more about that and what you see as the future of screenings like Cologuard?
Yeah, whenever you bring a new, brand new, dramatic innovation like Cologuard to healthcare providers, it takes a little while for people to really digest all of the evidence that develops and decide whether a new device or diagnostic is right for their patients. And now what we're seeing is that physicians are using this as an opportunity to study the data, which are really strong around Cologuard in terms of its ability to detect both cancers and precancerous polyps. And now we're seeing physicians just ordering Cologuard for patients frequently when the patient hasn't even come in to see them, because they feel very strongly about making sure the patient gets screened. And our goal is to go from today about 65% of people screened in this country to 90 or 100%. And you can do that with a non-invasive test that you can do in the privacy of your home, like Cologuard.
So Exact Sciences has had a strong relationship with Mayo on the research side of things. Can you talk about how that has been impacted by the pandemic and where that is now, including the development of your liver blood cancer test?
I have a whiteboard over here that lists all of the 15 different areas of collaboration with the Mayo Clinic. And this company started because Manisha Arora and I jumped in a car and went and visited Dave Ahlquist, Dr. Ahlquist from the Mayo Clinic, who had been doing colon cancer research for over 20 years. And he showed us data with that this concept could work of detecting colon cancer from a patient's own stool sample. That led to now an 11-year collaboration around the top 15 cancer killers in the US. And we are exploring and will develop and bring to patients and physicians tests for everywhere from esophageal cancer and pancreatic cancer and stomach cancer, and maybe a multi-cancer screening test, all because of this amazing relationship by this incredible physician researcher, Dave Ahlquist. And it's one of the bedrocks of our company is our deep relationship with Mayo Clinic. They're a team of 10 people in a lab and then dozens of physicians within Mayo Clinic who use our technology to test different theories about detecting cancer earlier or more accurately. And the world is changing. We're going to be part of that change with Mayo Clinic.
And what impact has the pandemic had on that? Has it slowed down or paused any of this research or delayed some of the stuff? And kind of where are things now?
There was a small delay early on, but we are back to moving forward as fast as we can. It's harder to get patients to enroll in studies that help us test some of these ideas, but I suspect that is going to continue to change, and we'll be able to be back at full scope in the coming months.
So you mentioned that a number of your employees have returned to work. Labs processing results in a lab is not something that really can be done virtually. Can you talk just a little bit about, as the leader of a company, the steps you took to bring employees back and how that worked and how employees responded to some of the steps that you took to ensure safety as you did this?
It's been a great learning lesson for me that if you challenge people to help others, that they virtually uniformly respond to that challenge. Mm-hmm. And so we have seen company morale, people walk around with their chest puffed out because they know the impact that they're having in this state, and they're continuing to take care of people with cancer. So what are some of the steps we took? Initially, because we saw volumes really go down, every leader in the company took a pay cut. Not over 300 people worldwide, and not one complained about it. In fact, many said, I can do more. And by doing that, we were able to have a much smaller impact on the number of jobs that were affected. So that was kind of one step. The other was bringing up COVID testing. And the third, which we never did before, was doing weekly video updates. Now, we could have been doing those, and what we learned during the pandemic is let's communicate more, and two ways. We've also been meeting with employees and doing Zoom meetings and getting a lot of feedback. So I see in a terrible time like this, there are really silver linings that make me think that we're going to be an even stronger company a year from now and 5 years from now because of what's going on.
And where are you guys at now in terms of roughly percentage of employees that have come back?
Well, we have all of our lab employees, so 1,500 people across the country that are coming into work every day. And that has continued. Bringing up testing enabled us to do that safely. And jumping on this really early. We led the way. Some people thought I was crazy when I said, look, we have to take drastic action right now. Well, people, we have 1,500 people who are safely back to work. And over time, more and more people will have the option to come into our offices as long as they get tested and wear a mask. Right now, I'm in the office. I'm not wearing a mask. But if somebody were to come into my office, the mask goes on. So if we take steps like that, we can safely start to bring some people back in who would like to come back in. We won't make people come back in until we get through this. And who knows what the future holds.
So COVID-19 has further exposed the significant health disparities that exist in Wisconsin due to racism. What responsibility do you have as the CEO of a large company to address racial equity, and what steps have you taken at Exact Sciences?
Yeah, I think that we all have a responsibility as Americans to try to improve our country. And obviously there is a long history of racial discrimination. And now, even when there is an affirmative discrimination, you can see significant injustice. And I believe that 99% of Americans are good people and want to play a role. And as CEO, I think that's true at Exact Sciences. You just don't see a lot of people being actively racist. But there are a lot of people who have never interacted with people of a different background. And so the first thing that we can do is to create avenues for people to actually have honest conversations. And secondly, and we did a lot of listening sessions, and what you heard more than anything else from our Black colleagues, we want opportunities for career growth, which, by the way, is the same thing you hear from white employees when you sit down and ask, what do you want? We want career growth and opportunities. And so now it's incumbent upon us as a company to make sure that Black and people of color in our company have the same opportunities that white people do. That's one thing. The other thing that we can do, and we as a team have come together and say, we as a company can change colorectal cancer screening across the country, because rates of screening for Black and Hispanic people in this country are much lower than for white people, and outcomes are worse. And Cologuard is a way we can put a lot of energy, effort, and dollars behind bridging that lack of equity. I mean, your odds of getting cancer shouldn't be dependent upon the color of your skin or how much money you have in your checking account. Everybody should have access to basic preventative care in our country, and we feel strongly about that.
Great. So one more maybe personal question before we shift to the audience questions in the little time we have left. Your name seems to come up in the past 8-10 years every time there is an election for governor. Tony Evers, like other governors across the country, Democrat and Republican, have a pretty tough job right now. Does this extraordinarily difficult time that we find ourselves in make you more or less inclined to maybe one day run for office? And do you feel that you have something that you could add in a leadership role like that during a situation like this?
I have often thought about it, and I always come back to I really get energized and care about continuing to change the world of cancer with Exact Sciences. And I have an incredible amount of respect for people who put themselves into harm's way by entering the political fray. I really wish that we could focus on practical solutions to our many problems to just keep improving our state and our country. So, I would never say never, but right now I know, and for the foreseeable future, I know that I want to be a part of the team at Exact Sciences.
Very, very good political answer. Shifting to the audience questions in the time we have left, what else can we do as a state to increase our testing capacity and the turnaround time for test results right now?
Like I said, there are 80 labs doing testing today, and that will go to 100 in the short term here. So everybody can, kind of streamline their processes, increase their throughput. And then also I think we can start to look at stratifying who needs to be tested and when. We do that to a large extent, but really identifying, is this a test for somebody who's about ready to go in for surgery? They get priority. Is this somebody with symptoms? They get a result at the next priority. And people who are asymptomatic, may have to wait 2 hours. So I think that there are a lot of things that we can do. And what you've seen is a straight line increase in capacity, both in Wisconsin and across the country. So the capacity is increasing. And then there is a whole group of entrepreneurs that are working on drastically changing the way you go about testing to increase capacity. And we helped fund a project that there are 45 groups of researchers trying to develop a new, rapid, inexpensive way to test for COVID. And we hope that something really good comes out of that, if for no other reason to help in the next pandemic. Because this is not just, this doesn't end here. We always have to be prepared.
Right. With this expedited testing, with the, as we talked about, just the speed at which this testing process came online, how do consumers have confidence that the rigors of accountability have not been sacrificed in this rush?
FDA has done a really good job of laying out a pathway towards FDA approval for these tests. And the tests that are being run are run under the FDA's oversight, and also an organization that audits and oversees the labs in this country. So these labs that are doing COVID testing are very proficient at doing COVID testing and other types of molecular tests. And I have confidence that the vast majority of tests, 99% are accurate in terms of, not having a failure because of poor lab environments. But, no test is perfect. And labs constantly have to keep improving everything they do.
Great. Kevin, with the time we have left, we're a little over time, but I'm going to take the final question. We talked about a lot today, covered a lot of different issues. What are you most optimistic about right now?
I think what I'm most optimistic about, some recent research that was published in Nature that shows that there is possibly our adaptive immune system, our T cells, have been exposed to other types of coronaviruses, and that is conferring a certain level of protection against this one. That's the best news that I have heard in some time. That, and you see so many people who are being thoughtful and caring of their fellow citizens by wearing masks. I think when you take those two things together with a vaccine probably coming in the first quarter of next year on a fairly broad basis, we can come out of this, and then we can all pull together and get our economy back to where it needs to be. So I was pretty pessimistic 5 months ago. I am quickly moving to becoming an optimist about this.
Well, Kevin, that's a good note to end on. Thank you so much for taking the time today to talk. Thanks to Briesen Roper and all of our sponsors for their great support. And thanks to everyone for tuning in today.
Thanks, Tim.
Thanks.